Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the Trade Department wants to open more shops and establishments to boost the economy after the Luzon-wide lockdown. We also get to know which industries will be allowed under the enhanced and general community quarantine, and how private companies will push through with COVID-19 rapid testing. Trade Secretary Ramon Lopez joins us live. With over 1 million COVID-19 cases, is it right for the United States to reopen its country? The challenges of flattening the curve and covering a pandemic. We speak to CNN's chief medical correspondent, Dr. Sanjay Gupta, later on the show. We are in for another phase of the new normal. Starting May 1, the Enhanced Community Quarantine, or ECQ, is extended in high-risk areas, which includes Metro Manila, Central Luzon, and Calabarzon. The Interagency Task Force also includes Pangasinan, Benguet, Baguio City, Iloilo, Cebu Province, Cebu City, and Davao City under ECQ, while areas not as affected by the novel coronavirus will be placed under a general community quarantine, or GCQ. These areas will have more relaxed quarantine rules. Some establishments and business operations may also be allowed to operate. Physical distancing and wearing of masks will still be in effect in all areas. Mass gatherings are still prohibited. Let's go straight to the source of the story. We have Trade Secretary Ramon Lopez. Secretary Lopez, welcome to the show. Thank you for your time, sir.
Good morning, Pinky. Good morning, everyone.
Secretary, it's good to find out which industries will be allowed to operate under ECQ. These areas, of course, I'll just repeat it, are Metro Manila, Calabarzon, Central Luzon, except Aurora. There's Pangasinan, Benguet, Baguio City, Iloilo, Cebu Province, Cebu City, and Davao City. Secretary, since we're quite familiar with the situation under ECQ, let me ask you, which industries will be added to the list of sectors allowed first, sir, under ECQ?
So under GCQ, General Community Quarantine, they sound the same. ECQ, GCQ. So under General Community Quarantine, the other manufacturing industries will now be open. So this will include now all those areas or industries outside the currently allowed industries like food and essentials. So here we're talking of all beverages, cement, steel, electrical, machineries, paper and paper products, motor vehicles, electrical equipment, and all the other manufacturing activities.
Okay.
It was also mentioned that there will be a partial opening of the malls. Right now, the malls are operating, but only limited to the supermarkets, the drugstores. With the partial opening, it can now open up the other services like hardwares and the laundry services, and then even the non-leisure, all other non-leisure stores that can include mga clothing, essentials. And then barber shops, salons, we recommended to open those services as well, subject to strict health protocol standards.
I think, Secretary, you're talking about the general community quarantine. The ones you mentioned are the industries that will open or the sectors that will open under the GCQ. That's right, no, sir?
The general community quarantine, yes. Under the general
community quarantine. Okay, so let's stick to that. Those were the sectors identified by Secretary Mon Lopez. Okay, so as you mentioned, sir, malls will finally reopen. Unlike before, doon po sa ang pinapayagan lang are supermarket and drugstores. Now, even clothing and accessories, and you mentioned barbershops and salons and spas, practicing strict health standards. Sir, can we find out what the strict health standards are?
Okay, so when companies start to welcome back again their employees, of course, many would start with their the usual health declaration. That will now be a normal new norm practices moving forward. Filling up certain forms, whether nakatabi sa COVID positive or there is some exposure, or if they're not feeling well, there will be those declarations. Generally speaking, coming from a quarantine, we're supposed to find out already if you are carrying the virus, if you're not feeling well. Yun yung purpose ng quarantine that we had or that we're having. Then, from then, magkakaroon ngayon ng testing to those who will need it. Like for those that are not feeling well or not looking sickly. But for the general workers, there will be they will just be following the strict health standards. So that would mean upon entering the temperature scanning, a lot of sanitation stations around, social distancing, very strict in the workplace as well as in the eating area, the canteens, a frequent washing or cleaning of yung mga frequently touch items, or like for example, in malls, in escalators, and of course yung general areas also na frequented by people. If you are entering a store inside a mall, since the store space will be limited, meron na prescribed number of maximum number of people that can be inside. So meron ding controls din doon. Otherwise, people will have to line up again with about 1 meter apart. So may mga ganung practices na that is the started. There will always be, I expect, we put in the guidelines lang that there will be mga roving officers as well to always make sure that the people are following social distancing. Things like those will be happening.
Secretary Lopez, so testing among the workers before actually going to work, whether symptomatic or asymptomatic, is not mandatory. Is that what you mean, sir?
Yeah. It's not mandatory, but from the companies we've been talking to, they're saying that they are making arrangement with their health insurance, the health insurance companies that they deal with. Some would require their employees or workers to have the testing first. Some are not, but importante doon, they have to make sure that yung mga workers, only the healthy workers will be allowed, of course, inside, and they can do those testing. So some are making arrangements. Some are covering for their expenses. Some will charge you to PhilHealth. So depende sa coverage ng mga health insurance nila at ng PhilHealth.
I see. Pero hindi po ito gagawing mandato ng gobyerno na bago po pumasok yung mga manggagawa ay matest muna sila whether they're positive or negative with COVID.
Yeah, oo. Kasi ang mga tinitest ngayon talaga yung mga PUMs and PUIs. But again, as we speak, yung nira-ramp up ngayon yung testing capacities. And we're talking of the PCR testing capacities. The target is something like 20,000 per day tests by May 15, and 30,000 tests by May 30. So by then, depende sa capacity din, one can really require yung pag-testing.
Secretary Lopez, what about sectors in the general community quarantine, such as resorts? Are they going to be allowed to reopen?
Sorry, did you say research? Hello?
Resorts, sir, under general community quarantine, will resorts be allowed to open?
Sorry, Pinky, the audio is not so good. So I'm not getting the words.
It's okay, Secretary. Tinatanong ko po, sa ilalim po ng general community quarantine, yung mga resorts, sir, papayagan ho ba silang magbukas?
Oo.
Resorts at hotel.
Sorry, did you say hotel?
Yes, I said hotel, sir, and
Ah,
resorts. For
oh,
example, beach resorts, sir.
okay, okay. Hotels. If you say hotels, let me put my for what? Hello, hello.
Yes, Secretary.
Okay. If you're asking
Hi,
about the
Secretary Lopez.
hotels,
Can you hear me? Okay.
yes. If you're asking about the hotels, they are operating right now, but they cater to the specific clientele
Yes.
base, like those under the returning OFW. Some of them, the frontliners, the those looking for accommodations of work for workers in permitted establishments like the BPOs and exporters.
Opo.
So those are the current arrangements being done with hotels. So hindi pa rin siya yung normal hotel service activities.
Okay, so that's clear. Secretary Lopez, wholesale and retail trade and repair of motor vehicles and motorcycles will be allowed under general community quarantine. And of course, no, Secretary, build will be allowed already in full. It's a general community quarantine, sir.
Sir, sorry, Pinky, did you say motor vehicle?
Opo, motor vehicles and build.
Oh, yes. So build, yes. So yung construction activities will resume in the general community quarantine. And the description is essential projects. But in the general community quarantine, right now, the recommendation that we have is essential public and private construction activities can now resume.
All right. After the break, we're going to ask Secretary Lopez which sectors or establishments will remain closed under a general community quarantine. Trade Secretary Mon Lopez will be with us after the break. You're watching The Source on CNN Philippines. Our guest today, Trade Secretary Mon Lopez. Sir, let me ask you so it's clear. Ano pong mga industriya will or sectors will remain closed? Yung talagang hindi pwede under GCQ, General Community Quarantine, or ECQ?
Yeah. So these are basically the non-essential activities that would usually have yung mass gathering, mass congregation. So entertainment related, those are in theaters, cinemas, the concerts, mga conventions, trade shows,
Mm-mm.
political rallies or parades. Of course, also the gyms and fitness studios, sports facilities, the travel agency, tourism,
Bawal po
the
yun. Mm-mm.
hindi pa rin natin ma-operate yon. Kasi binabalanse rin na Pinky in terms of yung the infection rate or the risk, transmission risk versus of course the essentiality of the sector. So pagka
Right.
one outweighs the other, the risk outweighs the essentiality. So they will still be kept close.
Yeah. Secretary, I'm sure it was a tough balancing act, when you try to look into the health and trying to kickstart the economy. So, parang for our, siguro, pag may mga questions, any mass gathering, talagang yun ang pinagbabawal. So, Secretary, also to be clear, dito po sa general community quarantine, yun pong mga papayagang mga sectors, that starts tomorrow, no, sir? May 1?
Yeah, correct. In the general community quarantine, we start tomorrow. So sa atin, sa mga NCR Regions 3 and 4, ano pa tayo? ECQ, Enhanced Community Quarantine. So
And I'm assuming, Secretary Lopez, a lot of people are gearing up, getting excited, preparing to go back to work tomorrow under the general community quarantine? Kasi marami na pong sectors ang allowed. What is your advice to them, Secretary Mon?
Of course, yung precautionary measures pa rin ng bawat isa, you still think positive, no? Positive yung katabi mo. So kailangan talaga magiging maingat ka pa din. The wearing of mask, kung pwede, face shields, kung masyadong you're dealing with many people or a lot of objects, you have to wear gloves. Yung frequent washing and sanitation will be very, very important. And hanggang maaari, you really avoid crowds muna, lalo na even in your workplace, no? So I think even in the workplace, maglalabas pala kami ng DTI, DOLE, and DOH guidelines for companies to follow, similar to what we were discussing at the start, when do they provide testing, the re-engineering of your offices, providing dividers, social distancing, etc., and all the cleaning activities and disinfection activities.
Okay. Secretary, kailan po lalabas yan, yung guidelines ninyo together with the DOH?
Well, we hope by today we can issue the announcement. We submitted it yesterday, so our technical guys are continuing the discussion. So hopefully we can finalize by this afternoon.
All right. Trade Secretary Ramon Lopez, sir, maraming salamat po sa inyong oras. Thank you.
Okay, thank you, Pinky. Thank you, everyone.
About 1/3 of the global coronavirus cases are in the United States. What challenges are Americans facing under this pandemic? CNN's chief medical correspondent, Dr. Sanjay Gupta, will tell us more after the break. You're watching The Source on CNN Philippines. The world continues to face the threat of the coronavirus pandemic. The United States alone has reached over 1 million COVID-19 cases this week, and about 1/3 of the current global total. But now the U.S. is slowly reopening its country and easing restrictions imposed to curb the coronavirus spread. Are they doing it right or too soon? Also the role of and importance of mass testing in flattening the curve, and the challenges of covering a pandemic for a journalist and a medical professional. Let's go straight to the source of the story. We have CNN's chief medical correspondent, Dr. Sanjay Gupta. Dr. Gupta, welcome to the show. So good to have you. Let me start with this. The U.S. has recorded over 1 million COVID-19 cases, and the current death toll is more than 60,000. Is reopening the country and the easing of restrictions a good idea? Is it a good move as of the moment?
Well, it does seem like it's a bit early in many places to be opening. You know, the United States in many ways feels like it's a big house with 50 rooms, and every room is somewhat dependent on the other rooms. We have some criteria, for opening here in the United States, which are just recommendations. And basically, Pinky, it's to see that the numbers have come down in a particular state for 14 days in a row, the number of newly diagnosed infections, and also to make sure that there's enough testing in place. And the truth is that in many places, really no place do we have that criteria met yet. So I think it's still too early to open, and the virus is very contagious, so I think we got to be cautious.
What would you say would be the biggest challenge right now in the United States?
Right now, I think it's a balance, as it is in many places around the world, between the impact that this is having on people's lives, on the economy, and the balance with public health. I think that the virus itself is the one constant in all this. It is a contagious virus. We know that it can be deadly, but I think people get a little bit complacent. We see that the stay-at-home measures, which we've had in the United States now for some time, have had a good impact. I mean, we've been able to reduce the spread of the virus in a good way, but I think after a while, people start to think, I think we'll be fine to reopen, and that's a risk. I think it's probably the biggest risk right now.
You know, Sanjay, here in the Philippines, we're doing targeted testing and we're still building up to do mass testing. Please walk us through the importance of mass testing.
There's two main reasons that you want to start thinking about doing more widespread testing. One is that here in the United States, and I think probably the same is true in many countries, including the Philippines, we don't really know just where exactly the virus is and how widespread it is. It's because it's such a contagious virus, because people may not have many symptoms but can still spread it. That's really important to know. Just where are we dealing with? We know that there are certain areas that are going to be higher risk than others. But I think the biggest thing is right now, in most places around the world, we're in mitigation phase, meaning we're just dealing with the virus, we're dancing with the virus as some have described it, but it's all about trying to slow it down. Ultimately, we want to be in containment phase, and that means basically trying to put a box around the virus and contain it. In order to do that, you got to find people who are infected right away. They have to be isolated, right. And then people around them, their contacts, they have to be traced. And the key to doing that is testing. You have to have the testing.
There are two tests, Sanjay, currently being conducted, the diagnostic test and the antibody test. I know that you recently underwent the the antibody test. Can you tell us more about that?
Yeah, so the antibody test basically measures your body's response to the virus. When someone has been infected with the virus, their body typically will make antibodies, and these are fighter cells that can help fight the virus if it's exposed again. In some ways, getting the infection, the belief is in some ways like getting a vaccine. We don't know that for sure, but that's the belief. That's typically what happens with these viruses. So if you have the antibody test and we show ultimately that gives you some protection, then you at least know that for a period of time you may not get the infection, not get infected with the virus again. That's different than the diagnostic test, which is testing for remnants of the virus itself. That tells you if it's negative, that you're negative at that point. It doesn't mean you're always going to be negative, but at least gives you some idea that you haven't been infected at that point.
But if the test reveals that you're positive with antibodies, that necessarily mean that you're positive with COVID-19? Or must you undergo the confirmatory test?
That's a really good question. If you go get the antibody test and it comes back as positive, it almost assuredly means that in the past you had the infection. It doesn't necessarily tell you when or how significant the infection was, but it does mean that you probably had the infection in the past. What we don't know still is, now that you have the antibodies, how protected are you from getting the infection again? Again, you should be protected at least for a little bit, but we don't know how long or how strong that protection is.
But how long do the antibodies stay in the body?
You know, right now we don't know, Pinky. I mean, we're still learning as we go along. It's only been, 4 or 5 months. So they're going to keep testing people who've been infected and see how long the antibodies last. I can tell you that in other similar viruses, such as SARS, that was another coronavirus, there was some evidence that the antibodies lasted, 2 to 3 years. But again, even if you have the antibodies, it doesn't necessarily mean that you're protected against. You should be, but we don't know for sure yet.
What about reinfection? Is there anything clear about that possibly happening or not?
It's not clear. It's a big concern, as you might imagine, that people could get reinfected. Once we have more data on these antibodies, and so that, again, this means that you got infected, now you have antibodies. The antibodies should protect you for a period of time. We don't know how long that protection is or how strong that is. But for at least for a period of time, it could be, a couple years like we saw with SARS, or maybe not. But during that time, you should not be able to get reinfected.
The WHO says that there are 6 vaccines currently on clinical trial. How soon can any of these vaccines be made available?
Yeah, there's several trials that we've been following closely. What we've heard from the head of the infectious disease community here in the United States is that it will take a year to a year and a half to possibly get a vaccine. Now, some of these companies say that they can do it faster. Some have said that maybe even by the fall, they may have some vaccines available for emergency use. We don't know that. I can tell you, Pinky, that the way that they're creating this vaccine, some of these companies, they're doing something that's never been done before. Instead of using a piece of the virus or an inactivated form of the virus, they're sort of using a genetic blueprint of the virus proteins and using that to create a vaccine. That hasn't been done before, but there seems to be a lot of promise around it. So they got to prove that it works. They got to prove that it can work in large populations of people. And then perhaps most importantly, they got to prove that they can make, hundreds of millions of doses, because, this is something that the entire world needs. So you got to prove that it works and then make sure you can build enough of it.
Sanjay, as a last question, as a journalist and medical practitioner, how big of a responsibility is it to balance giving information and at the same time making sure that it won't create any form of hysteria?
Yeah, that is always a challenge. There's the honesty, there's the hope, and there's the hysteria, And you never want to create hysteria. It doesn't really serve any purpose. I think the main thing that we journalists have to do is to make sure that we're being honest, but do it with empathy. I mean, I think this is one of the biggest health stories that I've ever seen in my life, because there's been other big stories, but not things like this that affect the entire world the way a pandemic does. So I think there's a role for being hopeful, but honesty always has to lead the way. That's the most important role that we have here.
CNN's chief medical correspondent, Dr. Sanjay Gupta, thank you so much for your time.
Thanks, Pinky. That was great. Thank you.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.